Hi, everybody. Happy Wednesday. We're so happy to be here today with my dear friends, Jennifer and Andrea. I'm so excited to do this wonderful webinar on mindfulness, acupuncture, and fertility. We have a lot of information. We're happy to answer any questions, and we're waiting for people to sign in. And so we'll be starting the talk really soon. Did you have a good day, you guys? Yes. The slides look so beautiful. They're so nice.
I know, it's good color palette.
Yes.
All of it. Yeah.
Really pretty. Well, good. Yeah, people are joining in, so that's wonderful.
Cool. One of them's probably my dad, because he watches everything. And then he'll text me, "Oh, you did a really good job."
My mom likes to watch them too. It's cute. And
Yeah.
Today's International Women's Day. That's so wonderful.
You know, I didn't know about that until I did my study abroad in Italy. And that's when I learned about it, which makes sense, International Women's Day, but I had never noticed it in the US before that.
Yeah, I follow UN Women, so that's how I knew about it. I heard about it from that. Wonderful. It's been nice to think about mindfulness because the kids are learning more about it in school too. I think that'll help the next generation.
You're right. My son's Wednesday after school enrichment class is mindfulness and art.
Oh, so good. Wonderful.
Yes, I'm happy to hear that.
Yeah.
He really likes it too. So
Yeah.
yeah, that and cooking class are the favorites.
That's so good. I need some cooking classes.
Are you in a cooking class?
I know. I only do simple things. That's
Roast chicken and broccoli.
That's it. And fish into the oven. Andrea is a good cook.
Well, it's my husband. I do less than the basic and like 5 different options. So not really good at that. And while I see more people joining, so while they join and you both start, why don't we take a mindful pause and just arrive, just here.
Yes. No.
As people are rushing in and we're just transitioning, and this is a good moment to just settle in your body and take a deep breath. And just feel your body. If you're sitting, if you're standing, just notice it. I'm sitting and I know I'm sitting. I feel it. I feel the chair underneath. I feel the weight of my body. And everything that we were planning for after the webinar or everything that we were doing, we can put it aside and just arrive at this moment. Okay, I'm gonna mute myself.
Yeah. Let's see, we're waiting for people to arrive, but we have a wonderful slide set and we're so excited to be here today to talk about mindfulness, acupuncture, and fertility and empower ourselves with information. I'll have you introduce yourself, Andrea, and then we'll begin because we have it recorded and some of our patients do watch it later and then we could post it later.
That sounds great. Well, my name is Andrea Nales. I'm at the slide, you can see on the slide, I'm a mindfulness facilitator through UCLA. And I'm here, as Dr. Alexander said, because these are tools that empower ourselves. Going through fertility treatments is something that is stressful and exciting at the same time, but these are just like practices that will enable us to have some agency on how we deal with the situations. So different emotions will arise and we will have tools to deal with them in a skillful way. And I'm happy to be here. Thank you for inviting me. And I'm looking forward to share some more information later at this webinar.
Great. And you're speaking first, but we did want to introduce Jennifer. She's in our office and I'll let her introduce herself.
Hi, I'm Jen. I think you've probably seen me before on some of the Instagram lives that I do with Dr. Alexander. I've been a practitioner for the last 15 years. I really love what I do. At this point in my career, I'm 99% fertility based, mostly women and the occasional partner that gets brought in. And I'm here several days a week.
And acupuncture helped me when I was trying to get pregnant in my late 30s. So I feel like it was so helpful for me at the time. So I'm from LA. I'm one of the fertility doctors at Southern California Reproductive Center. My passion and research has been on polycystic ovary syndrome. I have a lot of experience with patients with recurrent pregnancy loss, patients facing cancer who want to talk about egg freezing or embryo freezing. I went to UCLA, but I still love Trojans because my family is full of Trojans. And I went to Johns Hopkins for residency and fellowship. And then I was in academic medicine for about 8 years, and I've been here for 8 years. And it's been very academic here because we're constantly trying to improve our pregnancy outcomes, our egg thaw success. We're always driving the science forward with our fellows. And so it's been a wonderful experience to be part of such a lovely team. And thank you to my team who's in the picture here. At SCRC, our lab's been here for 25 years. We've had healthy embryos that were frozen 25 years ago and become healthy babies. We've been blessed to have eggs from 12 years ago be healthy babies. And so it's been a testament to our PhD in the lab, Dr. Jason Baird, who's so wonderful and very caring. And all the doctors here give a lot of TLC and individualized care. Our lab's on the 5th floor, and our blood test labs and ultrasounds are on the 1st floor. We put a lot of heart into every single patient, and our team cares and works diligently to get the best success for everybody. In the lab we have experienced and certified directors, double witnessing verification, blastocyst culture, vitrification, which is called flash freezing. We do genetic testing on embryos. It's called PGTA for aneuploidy and PGTM for monogenic disorders like sickle cell disease, cystic fibrosis, Tay-Sachs. We can do sex selection as well. And we have the EmbryoScope, which is a very unique and special time-lapse video analysis of the embryos to help guide us to which embryo is a little better and may implant and stick better than the next embryo. And so we take a lot of time with the team to optimize egg quality, embryo quality, and sperm quality. And so today we're going to touch on acupuncture, mindfulness, talk about fertility treatment options, our success here, talk about any questions, and answer any questions you have. We approach everything with a holistic approach. Nutrition's very important, meditation, acupuncture, and mindfulness is very important to us. And so actually, Jen, your slides are first, so you're first.
All right.
Yeah, I think it's, yeah.
There you go. So some of the benefits of acupuncture are acupuncture improves sleep, reduces stress, improves blood flow to the ovaries. When used as a treatment for infertility, acupuncture helps boost blood flow to reproductive organs. Acupuncture increases uterine stromal blood flow, helps balance your hormones, relieve stress, and can increase pregnancy rate by a little over 16% during embryo transfer. So that was a seminal study done a while ago that tracked that. Fun. So common reason patients are receiving acupuncture here at SCRC is to increase blood flow to developing follicles. And this isn't just the follicles that you're seeing on your antral follicle count, which is when you come in and they do an ultrasound and they count all of them. It's the follicles that are too small to see that are part of your ovarian reserve that are slowly growing and to be available for recruitment. And that can take about 90 days. That's oogenesis. So it's affecting the ones you see now and the ones that you'll see in 3 to 6 months. Acupuncture helps circulate the blood within your uterine lining to help it thicken up and be prepared for your embryo transfer. Can help regulate your menstrual cycles. So this is, sometimes more for someone's for more natural conception, but say you have a cycle that is only 22 days and you ovulate on day 15, you have a very short window in your luteal phase. So what will end up happening after several months of treatment is that luteal phase will increase. So for a patient who may have a luteal phase defect, their cycle is longer. They have at least 10 days for that luteal phase, and they tend to have just better cycles altogether. Acupuncture decreases menstrual cramps, has an effect on prostaglandins. Acupuncture decreases hormonal headaches as well as headaches in general, and I have to say it's incredibly successful. And then we also can do some first trimester pregnancy support symptoms, because I think for a lot of the patients who come in, that's the end goal. And we keep patients to, is it week 10? Till before we graduate them, and plenty of our patients will come in and they'll be nauseous and tired and cranky, and I can help with all of that. I thought this sort of felt like the right thing to touch on, because this is a mindful seminar, which is how do patients feel after a treatment? And I polled some of my patients over the last couple of weeks, and this is what my patients said. They feel there's a decrease in emotional stress. They'll come in and they'll have a lot of feelings, and they'll feel calmer after the treatment. They'll notice that they have greater physical relaxation. It's their body has like calmed, the shoulders have dropped out from being by their ears. They're breathing more deeply. The breath doesn't get stuck up here. They're breathing into their diaphragm. They often can have a better night's sleep. I hear that a lot. And they're pretty grateful to have a 30 to 40-minute break from their phone, from work messages, which might also be because their hands are actually pinned down, but and then sometimes first-time acupuncture patients will say they feel really good, like they kind of got high. And that tends to happen more with the first time you've had acupuncture, or if it's been a long time since you've done it. You're almost a little like so out of it, like you had a couple glasses of wine even, and then you drink some water and you feel just great. But no calories.
Yeah.
For you, Andrea?
Yeah.
Okay, so hi again, this is Andrea Nales. And as I mentioned, I'm a mindfulness facilitator. And many years ago, I went through fertility treatments as well. And back then, I was not meditating. I did not know what mindfulness was. This was 18 or 19 years ago. But I can tell you from my experience that if I had known all the benefits and how the practice has transformed my life, it would have been very helpful. So if you can help me, yes. No, the other one, the first one. Oh, well, yes, that one. Okay, so for those of you who have heard about mindfulness and don't know what's the difference between mindfulness and meditation, there's many types of meditations. It's like going and saying sports. There's sports that can be practiced on teams, sports that are practiced in water, or just different types. And same with meditation. Mindfulness is one type of meditation. Meditation is the umbrella. So mindfulness is a certain type of meditation where we focus on something, an anchor, usually is the breath. And then once our mind is more settled, then we investigate what's going on with me. I'm checking with myself. So it's a type of meditation. And also mindfulness is a way of paying attention. Is paying attention in the present moment, intentionally. If I tell you, okay, you are watching this webinar, but just like stop for a second and take a deep breath and notice, it's like, okay, the intention is to be here, because maybe you're watching the webinar, but you're thinking of something else. Maybe you're thinking of the stresses that the fertility treatments can, the stress that can arise from it, or the emotions, or maybe you're thinking about something else that you have to do after this webinar. So it is about being present in this moment with an attitude of curiosity and openness, and just accepting what is happening right now. Because I could be saying, oh, it's okay, it is, I'm present, this is what's happening to me right now, but you can be judging your experience. And when we practice mindfulness meditation, we are cultivating this acceptance. Not that you have to like what you're going through, not that you have to just do nothing, but the acceptance that comes from, okay, this is how I am feeling right now. I'm feeling emotional, I am feeling sad, I am feeling stressed, I am feeling tired, just about the acceptance of where am I right now? How am I feeling in this moment? And once you start doing a meditation, practicing mindfulness, you can have many benefits. And some of them are the ones that I'm showing here in this slide, like reduce stress and anxiety levels, improved emotional regulation and resilience, increased focus and clarity of thought, better sleep quality, increased compassion and empathy towards oneself and others. And I'm sure everybody can, or most of you who are going through this can say, you know what, yes, this would be helpful for me, because I'm going through stress, because I'm going through all these emotions, and I don't want to suppress them, but I want to be able to navigate them in a better way. And also, I want to have that clarity of thought that I can hear what the doctor is telling me, and I can hear clearly and see what the plan is, because it's not about just, oh, okay, just be calm and be zen. No. It's like, okay, I want to be calm so I can have clarity of thought and just be present for the process. And the sleep quality, that's, as you can, like many of you can attest, sleep really, the quality of sleep really impacts our daily life. So these practices really help. And also something that I've learned through my own practice is the compassion. And in this case, I feel that we need this compassion for ourselves. We go through so many things, and we tend to judge ourselves or to ask too much from us. Like, why am I feeling this? I should not be feeling this. Oh, and it's like, why would you treat yourself in a way that you would not treat someone else that maybe was going through some like struggle or something similar? So this practice also cultivate this self-compassion. And once we're compassionate with ourselves, we can be compassionate with others. Okay, next slide, please.
That makes me think of how sometimes patients blame themselves for, heaven forbid, a miscarriage. And I know from experience, like it's such it's what you just said resonated with me, because it's so important to really have compassion for everybody, and yourself and your partner. I think sometimes I notice there's tension built up between a couple, and it's hard as the physician. I'm trying to tune into each of them, and it takes a little finesse to do.
Yeah, I can really see this as a practice for a partnership to continue to stay connected, because sometimes one half feels helpless to be able to help the other person cope emotionally.
Mm-hmm.
Yes, and I hear you, and yes, I understand what when you're going through something like this. I understand that it's normal to us for us to go into the self-judgment, but self-compassion, it's not about feeling like pity, about like, oh, no, it's about seeing that we're humans. We're humans, and they're suffering, and it is part of the human experience. We're not alone. Everyone goes through these same emotions, different circumstances, different things that make those emotions arise, but we all have them. And also about being kind to ourselves, because it just the exercise for me is like, would you talk the same way you're talking to yourself to someone else? And many times the answer, or most of the times, if not all of the times, is no. So it's like, okay, just like if you're mindful, you can pause and notice that narrative that is going inside of your head and notice, is it helping me in any way through this process? No. And it's, okay, can I be compassionate? Can I be patient with myself? Can I be loving? Can I be kind to myself and to my partner that is going through the same process, but is dealing in a different way? So it's about that empathy and compassion. And with these practices, as we cultivate this, it's something that arises over time. And I have here on this slide just a short practice. You can take a picture of the screen if you're watching the webinar, and do this practice many times a day. It could be something long, it could be something short, but these are like moments of pauses that you can make throughout the day. It could be a 5-minute, it could be a 1 minute. And what happens is, if you tell me, okay, you know what, I want to get in shape, I'm going to go to the gym. And then you go once or twice, and you tell me, you know what, Andrea, this is not working. I lifted some weights. Someone showed me how to use this machine and nothing happens. My body hasn't changed. You would look at them like, okay, you have to do the exercise like all the time. It's a practice for life. It's like you need to be in shape it's not something that happens from one day to the other one. Same with the meditation. It is not something like, okay, you can do a meditation and go for a sound bath and listen to one that you can find online and feel that like, okay, it helped me. But the training the mind every day is what's going to be transformational. So same thing that you would do for your body as a train your body, you train your mind. It's something that you do on a daily basis. Not something like, oh, something else on my to-do list. But you can look at it as something like, okay, I'm just going to spend 3 minutes, 5 minutes checking in with myself. How am I feeling? How am I coping with these emotions today? And just, it's about going inward instead of always observing what's around us and what's happening and how we have to be productive and react. It's about, okay, stop, take a pause and go inward. So if you're have the time, can I do just this practice for 1 minute? Okay,
Yeah,
so
let's do that.
that's in practice. Just sit down with your back straight. If it's comfortable for you, you're not driving. If it's comfortable, you can close your eyes. If not, you can leave them open with a soft gaze in front of you. And just notice your body sitting or standing, the weight, and see if you can just soften the muscles of your face, relax your shoulders, knowing that the chair or wherever you are standing supports you. And now notice your body breathing. And while you're doing this, you might notice many thoughts that pop up. It's, oh, like I'm thinking about this, about that. It's normal. That's what the mind does. The mind thinks, and it's not about stop our thoughts when we meditate. It's about noticing them with a little space. It's like, oh, I see them. And what helps is to focus on an anchor. The anchor could be your breath, noticing how your chest or your abdomen expands and contracts. Or the anchor could be the sounds. Notice the sounds that are in that room where you are or coming from outside. Now come back to this moment. Take a deep breath in. And if you had closed your eyes, you can gently open them. And come back to wherever you are. Look around to your left, to your right, and look for something blue. Come back to this space. And I love that you're doing this at the Reproductive Center, because it is, as you said, it takes a holistic approach, in my opinion, because it is a way that the patient or the person can also have that, as you said, empowerment about. It's like I can also do something. I can rely on my wonderful doctors and nurses and all the team that you have, but it's also, okay, I can do this and this will help myself. So I'm happy to be here, and thank you for providing me this space. And
Thank you. I feel more at peace too, talking to you. Every time I talk to you, I feel so comforted, and thank you for all that you do for our patients and all your patients. It's so nice. And if anybody has questions about working, we are happy to answer any questions at the end too. And I'll speak a little bit about some of the fertility treatments we do. In general, there's been a big discussion out there about talking about egg freezing. I think a lot of us started families later in our life, and my generation wasn't offered as much to egg freeze, because in the American Society of Reproductive Medicine didn't make it not experimental till 2013. And so the science has evolved to be with vitrification, which is what our embryology team does. And vitrification, the survival of the egg thaw is much better than with slow freeze. And so the timeline is, as Jennifer mentioned, is that it takes 1 to 3 months before you do the process of vitamins, exercise, proper nutrition, mindfulness, getting good night's sleep, lowering your cortisol or your stress hormone. And then once we find a good group of follicles and have optimized your vitamin D level, your thyroid, make sure your pap smear is up to date. If you're over 40, consider a mammogram for a baseline as well. And once we've done the routine testing and evaluation, we can consider a protocol or medication called follicle stimulating hormone that stimulates the follicle. The follicle has a hidden egg inside that's smaller than a grain of salt. And those eggs grow over 10 to 12 days with some medication. And there's 5 visits during those days to determine how the follicles are growing, as well as your estrogen level. And during those visits, we adjust your medication up or down, because we're really trying hard to grow quality eggs as well as quantity without causing ovarian hyperstimulation syndrome, and as well as keeping you feeling well during the process. It's really important to drink 2 liters of water a day from non-BPA plastic. It's not the window of time to do intermittent fasting, because sometimes your pituitary gets a little startled if we're in a fasting mode. So we really want to amp up colorful fruits and vegetables and the Mediterranean diet. And during the stimulation protocol, keep your doctor posted how you're feeling. I like when patients say, I feel like more bloated than usual, or I feel like a lot of water retention in my legs, because then I say, hey, are you eating a lot of salty food? Try to avoid that. During the process, there's a trigger shot day, which is the most important shot of the protocol, that loosens the eggs from the sidewall of the follicle so that the egg retrieval can be timed. It's under light sedation. It's a 15 to 20-minute procedure. We carefully get the eggs out, and the eggs are flash frozen with vitrification, or they can be fertilized to create an embryo. After the egg retrieval, the most common complaint is constipation. So it's important to have Jen, or magnesium, to take magnesium or milk of magnesia. I know some of the teas I took to help my digestion and my stomach as well. And then any comments that you'd like to say?
I
Yeah.
have patients drink some water with lemon and chia seeds for a couple days going into it to just sort of get their a little extra fiber and those good fats so that their bowels will be a little more ready to go.
Oh, that's great. And you'll need a heating pad and Tylenol as well for afterwards as well. This is a beautiful image. I love this image. This is the follicles initially. These are each have one hidden egg inside. And as the medications develop the follicles into a larger size, we predict which day to trigger the eggs that will hopefully getting the most mature eggs that we can get so that they can be frozen or fertilized. This is an image of the vaginal ultrasound and how we use a thin needle and we get into the ovary and carefully drain the fluid that has the microscopic egg. During the IVF stimulation protocol, it's around 10 to 12 days of shots, and then the egg retrieval is the 20-minute procedure under anesthesia. And again, it's important to chat with your nurse and understand how to do your trigger shot really well. That night with the trigger shot, some people can feel a little dizzy, a little hypoglycemia. So I always say to have some trail mix or orange juice ready for you. In terms of embryo development, I love this picture. It's a beautiful image. This is a fertilized egg. It becomes 2 cells and then 4 cells, the 8 cells, 16 cells, up to a morula, and then the blastocyst. Genetic testing can be done on 3 to 4 cells from the outer rim. The baby to be or inner cell mass is down here. And this is an image of how we take the cells off. Genetic testing is encouraged when women are older or if they have a single gene disorder that we need to determine if the embryo could have a copy of genes from both parents that can affect the future health of that baby. And so it's important to think about this process if it's necessary. This is an image of the egg and it becomes an embryo. So right here is the moment of 2 pronuclei and then 2 cells and 4 cells up to 8 cells to 16 cells and into a morula, a ball of cells, and then to a blastocyst, which has the inner cell mass and the outer trophectoderm. So there's a lot of options we offer here: egg freezing, embryo freezing. Since COVID hit, a lot of men are freezing their sperm, especially as age is a factor. We're noticing men over 45, higher genetics issues pop up, including autosomal dominant disorders. And so it's important to think about that if you're not ready to have a family yet, to think about freezing. With vasectomies going up, some men are freezing sperm before they have a vasectomy. An IUI is artificial insemination or insemination, and that can be used with donor sperm or your partner's sperm. In vitro fertilization, it's surrogacy, and donor eggs or donor sperm. Some of our patients, even in their 20s, have premature menopause or premature ovarian insufficiency. It's not their fault. It's one of the some genetic issues as well as autoimmune issues can cause that, and as well as older patients where the egg quality may not be as optimal or the egg quantity, and so we talk about donor eggs. Donor sperm also can be. We have a team of people here with our third-party team that helps our patients find the best donor sperm. Our success here has been we're very blessed and we work really hard. So our pregnancy rate, even up into the 40s, has been quite high, and our miscarriage rate has been lower because we're able to genetically test the embryos and avoid genetic issues. It's opened up a discussion of mosaic embryos, which are embryos where 3 of the cells are tested, 2 are healthy and 1's not healthy. and what do we do with embryos that might not be healthy or may be healthy. And we're committed to our patients and helping them as much as we can. So our ethics committees are always meeting and trying to help discuss what to do with mosaic embryos. In addition, there are some discussions in terms of the single gene embryos and how to optimize getting the better quantity and quality of those embryos as well. And I always believe it starts with lowering our stress, mindfulness, acupuncture, vitamins, all the preparation you do to keep your body healthy gets us better egg quality and embryo quality ultimately. So any questions? I'll ask Andrea a question. When you feel like in the moment of trying to meditate, your mind's going a mile a minute, and let's say I sometimes patients will come in my mind and I'm thinking, what can I do? And I try to calm myself and think it through. And I sometimes write myself little emails and notes to myself to remind myself of things. But what can we do in those moments?
Okay, you know what? I always talk about informal practices and formal practices. So the formal would be the meditation itself. When you put aside like some minutes of your day and you sit down or lying down, and you have the intention of being still and focusing on your breath or the sensations or the sounds. And there are also informal practices. And it could be like I have some Post-its all over my house, and I've been having them for so many years now. It could be a week, I change it. It's like every time I touch the doorknob, I like pause and take a breath and look around and just check in with yourself and ask, what is the intention? What is my intention for the next thing that I'm gonna do? So it could be like every time you push the door with a new patient, is like, okay, use that like doorknob to pause. And it's like a cue of, okay, I'm pausing, I'm breathing, and I'm just being intentional about the next moment so I can be there for this patient. I don't know if you meant about you with the patients or to tell the patients to have these practices, but it would be the same. If it's for the patients, it would be the same. It's like, okay, once you maybe get in the car, like, and you touch the steering wheel, like, okay, just have that, like the touch, have a Post-it to, it's like, okay, every time I sit down and I touch the steering wheel, I take a breath and I just take a moment to see what's my intention right now. So you can really stop like thinking about the future and the past and be in the present moment, like a reboot.
So sometimes my patients, some of them do this, some don't. They like to have a conversation with their ex. Sometimes it's a pep talk, sometimes it's a promise of things to come and the future that they're going to have together. Thinking about patients sort of communing with their eggs, do you have any sort of add-ons or something that I could then, you know, if they have a conversation with me about it, I could add to what they're already doing?
That's so sweet.
Yes, you know, this is new to me. So I'm thinking, I love that they're thinking about that. And I would only add that, yes, it's just the fact that they're pausing to do this.
Yeah.
They're grounding themselves in the moment. It's like, okay, some things might happen in the future which are not in my control. Some things have led me to this decision right now. But at this moment, I am grounded, I'm here, and I'm just focusing on my eggs and talking to them. So I feel that itself, it's having a mindful moment of being grounded.
Yeah, I kind of always tell patients that, you know, they'll be like, oh, I feel like I'm trying to control so many things, or, you know, a lot of things I feel like I don't have the words for it right now, but it sort of feels like with the patients talking to their eggs, it's the reminder that parenthood starts even before you're a parent. And I think sort of practicing that level of presence is preparing you for all the challenges that come with the end result.
Yeah.
Exactly. As you said, it starts before the actual child is there. And also it is about, okay, like owning that moment where I don't know what what will happen, but in this moment, I see you. Like they see this eggs, and they know what this means, a new life. So I think I love the idea of doing that.
It's so beautiful. I remember when I was pregnant, I was so excited. I feel like because with, helping patients get pregnant all day, and then that moment when I realized, and then the first time you feel the baby move, it's such an interesting thing I had delivered a lot of babies by the time I finally was pregnant. And so I remember thinking, no wonder patients call, so, with those questions. I finally understood the pains and the spotting and the fears. It's very interesting having gone through all this too. Yeah.
Yeah, I think as women, for the good and the bad, it's a pregnancy loss allows you the compassion to be there for other people going through a pregnancy loss. And it's everything is a teaching moment on how we can connect. And I think the journey to the parenthood is the great economic equalizer. It doesn't matter how wealthy you are or how much money you don't have. Everybody is a parent. It levels the playing field.
Yeah.
Yes, yeah, absolutely. And it's about, it humbles us about, you know what, I'm not the first one going through this. I'm not alone. And yeah, you have more compassion for people going through the same.
Exactly. Well, thank you guys so much. And I really appreciate your time. This is so wonderful. I feel more grounded myself today. So thank you so much. And this will be posted as well. And our team here at SCRC, all the doctors, we're all very close friends. And we've helped over 20,000 babies and many memories here. We have a current promotion because we realize friends, when they freeze eggs together, we actually have noticed that we get more eggs and better eggs, and they help each other with the shots. And so friends, there's a special going on, and we have a New Year's special for IVF as well. And I'm happy to anytime our Instagrams are out there for all three of us. And thank you so much for this opportunity and to share our thoughts with you guys. Thank you so much. I am so appreciative of,
Good to meet you.
yeah.